Hi, I'm Dr. David Geier, orthopedic surgeon and sports medicine specialist, and I provide education and commentary on sports and exercise injuries and injury treatments and injury prevention for athletes and active people, probably much like yourself, so that you can stay healthy and perform your best. Now, as I provide all this information, one of the most common questions we get, kind of probably the whole reason that there is sports medicine, is that people want to know, when can I get back to sports? Or when can I get back to exercise? It doesn't matter what the injury is. It may be a shoulder dislocation. It may be, an ACL injury. It may just be some sort of muscle injury or muscle pain. They want to know, when can I play? I've got a game this week, and can I play in it? My season starts in 2 months. Am I going to be ready? And it's a very legitimate question to ask. So in today's Ask Dr. Geier video, I want to discuss, and I'm going to answer a question about this topic specifically as it pertains to fractures and when somebody might get back to play. Okay, Anton in British Columbia asks, I'd like to know when I'd be able to play badminton after I take my cast off. I'm a 12-year-old boy and 96 pounds. I fractured my tibia really close to my ankle, about a couple centimeters above the joint. It was a spiral fracture and wasn't displaced. It'll be about 8 weeks and 5 days. That's when the doctor thinks the cast can be taken off. But will I be able to play badminton on the day it's taken off? Well, it's a really interesting question. There's two components really worth talking about here. The tibia is the long shin bone, and you can break it in the middle of the bone. You can break it down close to the ankle, break it right up close to the knee. In kids, very often it doesn't need surgery. You can, especially if it lines up really well, put somebody in a cast, and it can go on to heal. It can still take a while, but a lot of times it doesn't need surgery. Where in adults, tibia fractures almost always need surgeries. Either a rod down the center of the bone or a plate and screws, but almost always need surgery. Now, the first factor, the most important factor on when somebody might be able to get back to play, and this is where it's a little hard predicting how many weeks it potentially would be, the fracture has to heal. Basically, the orthopedic surgeon on a regular basis gets these x-rays and basically says, yeah, it looks like it's healing well, but it's not done healing yet. But we use that not just to determine return to play, but when you could advance your weight bearing. At first, you may be non-weight bearing completely, on crutches, or not able to put any weight on it at all. Then we might let you bear weight, but with using crutches to help. Then we may let you put full weight on it, but you might be in a boot, and then you basically can be full weight bearing in normal shoes. But it's a progression based on how it's healing. But let's take the kid example. You get out of the cast, that may be a sign that the orthopedic surgeon feels like the fracture is completely healed. But again, then you have to go through a progression. Can you actually walk in normal shoes? It's actually surprisingly harder than people think. I broke my ankle in college, got the cast off, I think 6 weeks out, went to normal shoes, and it felt okay, but it didn't feel normal. I certainly wouldn't have been ready for competitive sports. So it usually goes through a progression something like this. Everybody's a little different. Everybody does it a little quicker or slower. But the progression is sort of like this. You get a cast off, or maybe it's getting a boot off after one of these types of injuries, and then you go to normal shoes. Then you start walking, and if you can walk okay in normal shoes, then maybe you start jogging. When you can jog okay, then you start sport-specific activities, landing from jumps, changing directions, things like that. If it's basketball, dribbling and pushing off and shooting. If it's a sport like soccer, maybe dribbling around cones, things like that. It really depends on what activities are required for your sport. So yes, some people may in theory be able to play sports the minute the cast comes off, but that would be really rare. Typically, you have to advance through that progression. You may do that really quickly. It may only take you a day or two, or it may take you a few weeks. So whenever the projection is that somebody can come out of a boot or a cast or a brace or whatever it is, there's time usually added on that is required to basically get somebody back to being able to do the sport or do the type of exercise that they like to do. Now, have you ever broken your leg, suffered a tibia fracture? How long did it take you to get back to sports? Or have you had another type of injury and you were in a cast or in a boot? How long did it take from when that cast or boot came off until you were able to maybe jog or play your sport? Was it a few days or was it a few weeks? I'd love to hear your experiences. So below this video, leave your comments. Tell us how your experience went. So I'd love to hear them, but I think it would help other people that are going through this very thing. Now, if you know people that are going through a tibia fracture, maybe they have kids that have had a tibia fracture and you think this would be helpful for them, share this video. I'd love to get this information out there to help as many people as possible. Now, if you like information like this on injuries and injury treatments and injury prevention, regardless of the sport or exercise, subscribe to my video channel. You know, I record a couple of these videos every single week, and I'd love to deliver those directly to you. Last, there's so many resources that I create, you know, video, audio, like podcasts, written articles, ebooks that, you know, I basically make completely free of charge, but I only share them with my email list. So go to my website, drdavidgeier.com, enter your name, enter your email list. I'll get those to you, on a fairly regular basis. And like I said, I always love to connect with people lots of ways, and email is one of those ways as well. Thank you so much for watching. Really enjoyed this. I hope that if you've had a tibia fracture, I'd love to hear your experiences on how you got back to sports or got back to exercise. And I look forward to seeing you right here next time.